While these commencement exercises are all about honoring our graduates, we like to take a few moments during the ceremony to pay tribute to some of their teachers. The L&A Copping Endowed Chair, established by the Louisiana Board of Regents, provides funding to support the L&A Copping Excellence in Teaching Awards at both medical campuses. This award is the most prestigious award for teaching in the biomedical sciences given by the two LSU Health Science Centers, and it is presented each year to selected individuals who, and I quote, are gifted in imparting knowledge, skills, and a lifelong quest for discovery, and who inspire the young men and women in whose capable hands will rest the health and well-being of the people of Louisiana for years to come. Because we have many outstanding faculty at the LSU Health Science Center in Shreveport, selecting a single basic science and a single clinical science recipient is a challenging task. This year's nominees continue to reflect the excellent cross-section of our teachers. The final winners are chosen by their leaders and their colleagues and their students. I'm very proud to present this year's, the 2016 awards. Along with the recognition afforded this honor, each recipient receives a lovely engraved award and a generous check from the L&A Copping Endowed Chair Funds. As I present this year's winners, I ask that they come to the stage to receive their awards. This first award is for excellence in teaching in the basic sciences. This year's recipient is a senior member of our faculty and an established and accomplished research scientist, which is praiseworthy in itself in these days of diminishing research funds. But this award is for teaching. It can be easily said that this year's recipient contributes to education at our Health Sciences Center at virtually every level of the process. You know, in sports, they use the term triple threat for a player that excels in 3 essential skills required for that sport. You could call this recipient a triple threat in education, and let me tell you why. In the School of Medicine, this recipient now teaches in 4 different courses, serving as the primary course director for one of them. This individual also carries a heavy teaching load in the School of Graduate Studies, teaching in 3 of the interdisciplinary courses, as well as 2 additional departmental courses, and serving as the director for 2 of those courses. And at a moment's notice, as does happen in our institution once in a while, a faculty member who is scheduled to give a set of lectures in a course cannot do it, and even worse, notifies people about that with short notice. In the recent past, this occurred in our School of Allied Health Professions and was in the field of expertise held by our recipient, and yes, with essentially no arm twisting necessary, this recipient stepped up and took on those lectures as well. So we're talking about a faculty member who provides education to students in all 3 of our schools, and in that way is a triple threat. Secondly, the term triple threat also applies in relation to levels of participation in education for this individual. As I said, this recipient directly educates our students through lectures and other activities, and at the next level of responsibility, this recipient, as I said before, serves as a course director, not only in the medical school curriculum, but also the graduate school. And at the 3rd level, this individual serves on the committee that has the primary responsibility for the entire medical school curriculum. In a second way, a triple threat. And finally, and to me, the most meaningful way, the nominations and the words of praise submitted about this recipient were submitted independently from 3 different groups: medical students, graduate students, and from the faculty, all describing the recipient's excellence, dependability, and dedication. Let me share just a few of these statements with you. From a medical student: he made it so easy to understand that I was able to answer a lot of the basic science questions on the clinical rotations in my 3rd year. You have no idea how thankful I am to have been able to learn these subjects from him. From a graduate student: he has the ability to explain difficult topics in depth and yet simplify it to be easily grasped by students. He's earned a staggering amount of respect from his students and his colleagues. From faculty and colleagues: it's clear from our students that they are happy to see him in more than one course. He is extremely well organized and thoughtful in how he organizes and directs courses, and it's not only the students, but also the faculty teaching in those courses who recognize the excellent job he does. It makes our job easier and the courses run smoother. And from me, this is one of the most reflective educators I think we have. Very few faculty members I know routinely seek out student input, on their lectures or their educational activities, and so that he can use them to improve those things the next time. He's a model educator for all of us who attempt to provide medical or graduate school education. So it's my pleasure to say that the LSU Health Science Center in Shreveport's 2016 Alan A. Copping Excellence in Teaching Award for the Basic Sciences goes to a professor in the Department of Molecular and Cellular Physiology, Norman R. Harris, PhD. Our second award is for excellence in teaching in the clinical sciences, and the recipient cannot be described as anything but iconic. An invaluable member of our faculty for over 3 decades, it can be said that this recipient teaches us all, and teaches one of the most basic, yet seemingly underrated skills that all physicians need in abundance, no matter if they're a pediatrician, a neurosurgeon, an anesthesiologist, or in any field of medicine, and that's communication. She also takes on responsibility for teaching those topics that some would say are difficult or sort of uncomfortable to teach. Addictive disease in the first year of medical school, domestic violence and sexual abuse in the second year, ethics in the obstetrics and gynecology clerkship and to the students who participate in the Ronald George Scholars Program, and patient education in the senior year. And specifically, she is our own expert, actually a nationally recognized expert in health literacy. Because of her, our students have been learning about the ways in which poor health literacy serves as a barrier to health care for years, long before it became a national topic of importance as it is today. By teaching about health literacy, she teaches our students and our physicians to help their patients better understand their own health, where they can get health information, how to communicate their needs and preferences, understand the choices they have in their treatment and the consequences of choosing one over another or of choosing none. Students learn how the level of education, the culture, the economic situation of a patient, their lifestyle, and many other factors impact a patient's health literacy. Ultimately, this recipient is teaching the students and the physicians how to empower their patients to take an active role in their own health. As though this wasn't enough, she's faithfully provided students with workshops, small group lunches, and other activities that help them deal with their own health. Sessions on anxiety, time management, and my favorite, stress management, providing students with resources they can utilize to maintain their own wellness in medical school and as they progress to become practicing physicians. Nomination letters came from all levels, individual students and groups of students, one whole class of students, residents, fellows, faculty from her department and from other departments, and here are a few of their comments. She always makes lessons relevant and practical. Her teaching style is unique in that she involves patients and their perspective. What a concept. The most resonant part of her teaching is the focus on empowering patients. Medical curricula bombard students with basic science, pathology, diagnostic studies, and an assortment of other sterilized information. Occasionally, medical students need reminding that caring for patients requires as much kindness and humanity as it does clinical knowledge. She embodies the spirit of medicine that inspired all of us to pursue the profession of medicine in the first place. Another said, she is a magnificent example and role model of the passion and drive that every educator should strive for. A graduating fellow in the medicine department said, she has been instrumental in making me a physician. I know that she will be a lifelong mentor, and I also consider her a friend. I include myself when I say she is a teacher to us all and has served as a mentor for many of us, and it is my honor to call her friend. The LSU Health Science Center in Shreveport's 2016 Alan A. Copping Excellence in Teaching Award for the Clinical Sciences goes to a professor in the Department of Internal Medicine, Terry C. Davis, PhD.